Good evening. My name is Harry Burkholder. I'm the Executive Director of the Land Information Access Association. And some of you might be coming here saying, who are you and what are you doing here? And tonight we're going to talk about that. I really want to thank you for coming out tonight and beginning this process to talk about a master plan for the island. Usually I open these kind of meetings with how many people live in the community, but I'm guessing that answer is a pretty easy one.
Which community?
This community. How many people from Peon Township? All right, how many people from St. James Township? All right, pretty good. All right. So how many of you have heard about this process only within the last 24 hours? A couple people, good. All right, so let me kind of explain why we're here, who we are. There we go. So tonight's agenda. So I'm going to provide an overview of the project. Who is Leah? What is the project and what is resilience when we talk about that? And what is the master plan and what does that mean for the island? So I'm going to give a nice background on why we're here. Part of what we want to do as part of this process is bring some information and resources to the island on issues that are important to you and issues that we think talk about resilience. So we actually have a guest speaker, Roger Racine from the Michigan Department of Health and Human Services, is going to talk a little bit about climate change, climate variability, and the impacts that have on people, and people specifically within kind of the northwest region of Michigan. And then I'm going to talk a little bit about an upcoming project that some of you probably already heard about, which is a water trail. This is something that we hope to kick off in October, so I'm going to talk a little bit about what that means to do a water trail. And then if you're patient and you have enough cookies and coffee, we hope that you stick around for a group visioning activity that will help us kind of kickstart this master planning process. Okay? So who are we? We are the Land Information Access Association. We're a nonprofit group out of Traverse City. We've been around since the early 90s, primarily focused on civic engagement dealing with land use. Our organization has kind of a three-legged stool. We do community planning, which we're here to do right now. We also have a technology wing where we do websites and databases for large nonprofits and jurisdictions across the state. And then about 5 years ago, we took over the public access station for Northwest Michigan. So about 5 years ago, we built an actual TV studio in our office, which you'll see in the back. So part of this process will be videotaped and will go as part of the website, which I'll talk about in a minute. But we've been around since the early 90s, primarily focused on civic engagement around these planning processes and also working with multiple jurisdictions. So focusing on master plans that deal with a city and a township or two townships, a city and 4 townships, because there's great crossover and a great need for cooperation when we talk about land use planning. So that's exactly what we've done. And we've tried to incorporate all of these things, and this is actually our tagline if you go on our website, supporting civic engagement, helping people shape better communities. That's what we're all about, and that's what we hope to do and assist you in getting your master plan done. Again, we do that by participation, civic engagement, which I mentioned. Education, so part of this process, as I mentioned, is bringing resources to the island to learn about not only resiliency, but some of the issues that you're already grappling with right now. And then some of the effective uses of technology and things that we're going to be studying. So that's who we are as an organization. You'll see probably several of us as part of this larger process. So Joe Torrance is filming in the back. Claire Carner and Katie Sieb are waving right now. They're community planners. They'll be all part of this process. Most of the times you'll see at least 2 of us. Sometimes you'll see all 4 of us as we go through this process. So what are we doing? The whole mission or the whole purpose of this project is to update the 2 township master plans. And you say, well, hasn't that been going on for a while? And the answer is yes. So the last full master plan update was in 2006. Since then, the planning commissions have been kind of going at it, trying to revise it and update it, but it's taking some time. So we don't want to throw any of that away. All that stuff is really good. It's really valuable. We just want to add on to that and build upon that. So build on all the work that's been done by the planning commissions, but also utilize and build upon all the work from the Island Institute. So we know that you went through a very comprehensive process, have a lot of great ideas, have a lot of very specific projects and initiatives that you're working on. We want to build on that and add that to the master planning process. And we also know that you've already done a lot of things or in the middle or in the process of doing a lot of different initiatives. This building that we're in right now is an example of that. All we want to do is, again, build on and utilize all the things that you've done into this master plan document. So you say, well, how did you even get here? So we've been working on this resilient master plan concepts for the last 5 years. You can see on the screen who the funding has come from. The first grant that we received came from the Kresge Foundation. And since then, the Coastal Zone Management Program of the DEQ, of the Office of the Great Lakes, has funded our work in other coastal communities within the state of Michigan with this lens of resilience and coastal planning as a focal point. So we've worked in Monroe, Ludington, St. Joe, Grand Haven, Macomb County, East Jordan on these types of master plans that have a special emphasis on the water resources and the Great Lakes coastline and resilience. So 2 months ago, we got a call from the Office of the Great Lakes saying we have some money. We heard that Beaver Island is working on this master plan. They need a little bit of help to get it to the next stage. Would you be willing to work with them? Of course, we said yes, but let's ask the townships first. So about a month ago, I came and did a presentation to both planning commissions and said, would you be interested in this process? They both said yes. The 2 township boards then passed a resolution saying we agree to work with Leah on the master plan for the price of $0. So the Coastal Zone Management Program and the Office of the Great Lakes is funding this entire project. So no dollars from both townships are working at this. All we're asking is your time, when you've already done that tonight, so we're really appreciative of that. Part of our partners on this larger resilient planning project is the Michigan Townships Association, the Michigan Association of Planning, and the University of Michigan. So those are some of the resources that we can bring to the table, some of the work that the University of Michigan has been doing about coastal dynamics and how social systems and our ecosystems work together to provide for community are things that we're going to bring to the table as part of this process. So what we're proposing is a little unique. So we're actually looking at a unique master planning effort that focuses on different ways of planning for the community, focus on the cooperative preparation, adaptation, and creative development of community systems in the face of changing conditions and circumstances. So that's what's a little bit different about this process. Most master plans are really the foundation for the zoning ordinance. And that's not going to change here. That's part of this process. But we know from our conversations so far, most of the zoning issues that have been discussed and settled a long time ago. So we're not about to change the different types of land uses on our coastline. That's all going to be residential. There might be a few pockets that I've heard discussion about what kind of density it might be, but actually the zoning piece is almost pretty much settled from what we've heard in the last 24 hours. What we want to do is talk about how are your transportation systems working around the island? How is your EMS working around the island, which I know is a big issue? How is broadband communications working to work with all those systems to make your community whole? We hope to bring that to the forefront of the master planning process. And we do that because that's really the best way to think about how we can respond to disruptions or shocks to the system, or how we navigate changes or unexpected things that we can't really plan for. Learning to adapt as a community to those changes, and these are things you're already doing, as part of what being resilient is. We hope that this process, and especially the civic engagement piece, does that. So you're saying, well, what changing conditions and circumstances are out there? Well, this is what we've heard. These are things that you've identified in the last 24 hours, plus all the things that you've done with the Island Institute already. We know there's an aging population. We see a lot of homes for sale, and those grandkids are not buying those homes again. So we were wondering what of our population going to look like in the next decade to 2 decades here on the island. We understand there's some issues with workforce housing, especially in the summertime. Do we have enough places and enough affordable places for the workers on this island to live all year round? Access to health care, we know that's a huge issue. What does that mean for our community, not only for an aging population, but for families moving to the island that have kids and want health care? Reliable access to broadband technology really impacts all of these. That impacts healthcare, that impacts education, that impacts people who can work and create an economic viability for residents all year round. So those are the things that are already talking about in this island, and we want to continue to do that. And then we have the next unknown shift. So what's the new thing that we can't predict yet? In 2007, 2006, they didn't know about the housing crash or the economic crash in 2008. There's things that we just can't prepare for. Can we start to think about some of those now, or can we actually create a community dialogue that lets us be better able and nimble to respond to those when they do come up? That's part of being resilient. And you've already been doing this. So this isn't actually a new concept. It's just maybe under this new umbrella word resilient that we're talking about for the first time. So you're already talking about ecotourism. The fact that you have the birding trail, when we're talking about water trails, you're talking about ways to leverage your initial assets and your recreational assets for economic development. We want to talk about that. All the work you've done with invasive species has been remarkable. That's being resilient to the impact that you weren't anticipating in the years previous. So you're doing some of that work. All the community-supported projects and community partnerships, again, the fact that we're in this building is an example of being resilient. And I know there's other ways that you're looking to do that, especially with the broadband and the healthcare. And then all the work that you've talked about at the Island Institute really encapsulates some of those issues. And again, we just want to make sure that we're leveraging and expanding on that conversation as part of this master planning process. So what is a master plan? What I've been really amazed with, just about every meeting that we've gone to, we've said, who's actually worked on a master plan? And almost every hand has come up, whether they worked on it 5 years ago, 10 years ago, 15 years ago, if someone's had a plan in a master plan or had a job in the master plan. So really, it's a document, but it's much more than that. It's a process, and it's really the guiding document for the community. We start with a formal assessment of the strengths and weaknesses of the community. So we look at all those systems. How are our natural systems? How's our transportation system, our healthcare, broadband? What's the status of that? What does that mean for the island? We do lots of civic engagement. So this meeting tonight will be the first of, we hope, several public forums that gets to what your goals and objectives are, what your issues are that we can address as part of this process. And it really is then the blueprint for how we develop as an island, how we develop as a community. The great thing about a master plan that should all be recognized is that it's a flexible document. So by law, you need to update your master plan by every 5 years. That's planning enabling law. So we're actually past that point. But it's something that you should review on an annual basis because things change, circumstances change, population shifts happen. So we want to be able to create a plan that's flexible to meet the needs and some of the initiatives that you're already working on. So how was that master plan used? As I mentioned before, first and foremost, it is the basis for land use regulations. So it should support the zoning ordinance. What we're talking about is doing a little bit more of that. Can it guide decisions or can it inform decisions on development and capital improvements within the island? Can it provide support for grant requests or millages, or can we actually talk about ways that we can do public-private partnerships? We hope this document, this planning process will support those efforts that really get to the quality of life here on the island. And then we also hope that this process positions the community and everyone in this room and all the residents to then meet those future challenges which we just don't know are going to come yet. So that's really what the master plan does when we look at this kind of wider spectrum or this kind of ecosystems approach to it. Our timeline is fairly quick. And part of the timeline was determined by the extent of our grant. So when we got the call 2 months ago, they said, by the way, this grant ends in February of 2017. So can you get moving quickly? Well, that's why we're here. That's why it kind of seems like where'd this come out of nowhere? And we also heard from the Planning Commission that we've been working on this for a while. Can we actually make some momentum and progress? So we put together a preliminary work plan. What I've said to both planning commissions is, this is your document. This is the community's document. We move at your pace. The grant, if we have to go over the grant period because you're in public comment or there's other issues that need to be addressed, then so be it. But we hope to start reviewing existing documents and meeting community stakeholders in the kickoff meeting. That's what we're doing right now. Here we are in August. By September 13th, we hope to come back to the island with a report on some of the data that is important to informing some of the decisions that we hope to do. And looking at your population is part of that. Also, we'll be, again, meeting with community stakeholders to talk about what vulnerabilities we might have, both from an environmental perspective, but also from a human perspective. And we'll talk a little bit more about that later. By the end of September, we hope to have kind of an outline of our master plan. Again, dovetailing on what's already been done, not repeating it, and still doing more stakeholder meetings. In mid-October, we hope to come back for 2 public meetings. We call those kind of a workshop where we bring in some additional speakers to address some of the issues that you're already talking about or already trying to figure out or grappling with. We'll talk a lot about what the vulnerabilities of the island are, what those risks are, and how we might be able to meet some of those. We've reached out to the local school, and we're meeting with them tomorrow. We hope to actually have an exercise that we do with the students on the island. We don't know what that exercise will be yet, but we hope to incorporate them into that. We hope to do all that in October. And then by the end of October, we have to actually have the draft plan for the Planning Commission to review. By November 8th, we hope to have the plan available on our project website. I'll talk about that in a second. And then present their draft goals, objectives, future land use to the public at an open house just like this. And then the other thing that we hope to bring is that implementation matrix. So a lot of times you'll see these planning documents that just have goal, vision, goal, vision, goal, vision, and there's no discussion about how do you get to that. We hope to change that. So we want to bring tools to the table. So when there's a goal, an objective, and a vision, it says, these are the resources that are available from a state level to help implement that. Here's the organizations that might be able to assist in that, to then line some guidance in terms of how the two townships go about making that change happen. And then in November, we present the public comments to the Planning Commission, and we hope that they then start a 63-day comment period. So even after all the public input we do, there's still 63 days to give a public comment. Both planning commissions have to do a public hearing. Then it gets approved again at another public meeting at a township board level. So there's lots of opportunity for input, lots of opportunity for conversation, and also lots of opportunity to have those sayings at the planning commission and at the township board level. Yes, Beth. Is that the hunting season? Opening day, okay. Good point, yeah. So around November 15th, or everyone will be wearing orange and camouflage at the meeting, we'll see. All right. So by January, we hope to have those public meetings set, those public hearings, and then potentially have the master plan adopted. Does that make sense in terms of a timeline, what we're trying to do? So you're saying, so how do I know what's going on? How do I stay engaged? What do I tell people that don't live here in the wintertime how to do that? So far, we've been on the Beaver Island Forum. We do have a presence on Facebook, News on the Net. I know we're having our session videotaped here tonight. Mo was kind enough to interview us on the radio, which I heard played a couple times yesterday and today, which is fantastic. We will have email notices out. And then we also created a project website, which you'll see on the bottom of this slide, www.resilientmichigan.org/Beaver Island. This is what it looks like. So we're going to have a nice description on what this project is, and then on the side here, you'll see project information, how to get involved, share your ideas, project documents, who to contact. Everything we do with this planning process will be on this website. So meeting notes, flip chart notes, interviews, videos, they'll all be on this website. We'll probably also post questions on this website that we hope to get responses to. So there's lots of opportunity, even if you're not on the island, to be part of this process, and we want to make sure that we're doing that. That makes sense. So that's really the summary of who we are, why we're here, which is the biggest question that we heard for the last 24 hours. Any questions on process or questions on how we're trying to incorporate previous activities? Clarifications? Okay, good. All right, so the other piece of tonight that we hope to do at a lot of these public meetings is bring some information that might not have been discussed in the past or something new to the table to help us inform our process and inform the way that we create goals and objectives and priorities. So I'm going to have Roger come up here in a second to talk a little bit about climate change or climate variability and how that's impacting people in communities. So I'm going to give the very much Reader's Digest version of climate change that we've seen so far. We hope later in the process to actually bring the state's climatologist, who's one of our partners, to really get into depth about this. So this is the glossy overview. So in terms of projected-temperature-related changes, there's been dramatic changes from 1971 to 2000, and then we're projecting that in 2041 to 2070, it's going to increase dramatically. Not dramatically, but significantly. That we're just going to be warmer, and we're going to be hotter, and those seasons are going to be longer. So our falls will be longer, and our springs will be earlier. We also have seen trends in terms of precipitation that it's going to be wetter. So we're going to have more precipitation in the amount of rain, or heavier precipitation, which means we're going to have a warmer and wetter climate. So what does that mean for Northwest Michigan? What does that potentially mean for Beaver Island? So increases in winter and spring precipitation, less precipitation as snow and more in rain. So not counting the last two winters, which were kind of an anomaly in terms of the overall trends for the last several decades. Less winter on the ice and the lakes, greater frequency of intensity of storms, And we heard kind of over the last couple of days that storms have a way of going around the island, and maybe that's the case. More flooding events and risk of erosion, especially in coastal areas. Some of you who have seen your beach go from 60 feet to 2 feet know what that means. Increases in frequency and the length of severe heat events, and potentially drought, and especially in the summertime. And that has impacts on not only environmental systems, but our social systems. So in terms of rivers and streams and lakes, a decline in clow-water fish, that changes the fisheries of our community. The potential for increases in stormwater runoff are there because we have additional or increased storminess. It impacts our plants and wildlife, which we know is very important to the island. In terms of what we're doing for energy and industry and our infrastructure, that all has impacts on how that functions, how that works. That'll all be part of what we're talking about. And then Roger's really going to talk about what's the public impact of a changing climate as we move forward into the future. So I'm going to turn it over to Roger, unless you have any other questions for me. All right, Roger. I'm going to change PowerPoints here, but you can go ahead.
Hello, everybody. I'm Roger Racine. Thank you very much for Leah inviting me to come out and speak with you tonight. It's my first time on Beaver Island, and really excited to bring my wife and children back on another future visit. Hopefully not too far in the future, but summer days are shortening. So yeah, I'm an employee for the State of Michigan Department of Health and Human Services. I'm an infectious disease epidemiologist, and I'm also very well versed in environmental epidemiology, where I previously worked before transitioning to infectious disease so that I could live and work in Traverse City. So yeah, I'm here speaking on the behalf of the MyCHAP program, the Michigan Climate and Health Adaptations Program. Funding for that began back in 2009 from the Centers for Disease Control and Prevention. And that funding is focused on the state of Michigan along with 16 other states and 2 specific cities through the Climate Ready States and Cities Initiative. So we're really focusing on federal and state and local partnerships, integrating climate adaptation into the public health practices, and promoting adaptation strategies to protect the public health. Slide, please. All right, so there's our outline. We'll be talking about climate change in Michigan, which Harry talked about a little bit, how climate change affects health specifically. Also, climate change vulnerabilities within our community, and mitigation and adaptation as a response for public health. So, climate scientists agree that climate change is now underway, and all over the world we're observing the early signs of a warming climate. Here in the Great Lakes region, such signs are also being recorded. So temperatures are rising, especially in the wintertime. Winters are also becoming milder and shorter. Warming winter temperatures with increases in ice and freezing rain, and spring's arriving earlier with increasing frequencies of intensity of storms and severe intensities increasing. Climate future generations may experience fundamentally different from the climate that we have today. So by the end of this century, Michigan summers will possibly feel more like the current summers in Arkansas, and winters more like what they are currently experiencing in Ohio. So in the short term, which would be 25 to 50 years, we're expecting a few specific regional impacts. So for the western upper peninsula, parts of the Mitten, upper Mitten, climatologists project warmer days, especially in the wintertime, and more precipitation in the wintertime. Falling as rain, maybe freezing rain, and rather than snow. And also more poor air quality days, especially with ozone, and also more extreme precipitating storms resulting in flooding. So worldwide and in the United States, leading scientists and public health practitioners are sounding the alarm. Climate change is bad for people. So let's review how climate change impacts health globally and in Michigan. So generally, we can think of climate health impacts in terms of extreme events and also more subtle changes. These are the major areas highlighted by the leading public health authorities and mentioned in the third National Climate Assessment. Extreme weather events include things like heat waves, storms, floods, droughts, and wildfires. And the health impacts of those events include injuries, heat-related illnesses such as heat stroke, heat exhaustion, and deaths. We're also interested in worsening of chronic heart and lung conditions, more subtle human behavioral problems like anxiety, depression, and mental stresses, also social disruption and housing displacement. And then disruption environmentally would include things like degraded water and air quality and habitat changes. And then health impacts of those would include things such as changes in vector-borne disease, water and foodborne diseases, asthma and allergic conditions. Thank you. So my chap is focusing on 5 priority climate-related health impacts for our state. Heat-related illnesses and mortality, respiratory conditions exacerbated by particulates and ozone air pollution, pollen and mold, especially mold inside our homes, storm-related injuries, carbon monoxide poisoning due to the use of gas-powered machines such as generators after a power outage, waterborne diseases and toxins such as algae blooms and sewage and septic failures after extreme rain events, and then vector-borne diseases like Lyme disease and West Nile virus. Those are spread by mosquitoes and ticks. All of these have the potential to increase as Michigan's climate changes. So we'll be focusing on these conditions as we develop interventions and adaptations to reduce their impacts in our state. We do get heat-related illnesses in Michigan, especially during extreme heat events or heat waves. It's not just a southern state problem. Although less severe than in southern, more urban areas of the state, this part of Michigan is not immune to heat health effects. As you can see here, even in northern Michigan's Region 7 on this map, they had almost 300 emergency department visits in a typical summer. So this would be from the year 2013. And these numbers we would expect to increase in the future as our climate warms. Severe storms are expected to increase with more extreme precipitation and with more winter precipitation as rain or freezing rain rather than snow. And this can lead to a number of adverse health impacts, such as physical injuries from drownings and accidents, allergies to mold, food and waterborne illnesses, physical displacement from our homes, mental health issues, interruption of emergency services, and carbon monoxide poisonings. Now, this part of Michigan tends to be pretty stormy compared to other parts of the state. There were a number of severe storms between 1996 through 2016 in Charlevoix and Emmett counties. Storms were specifically counted for St. James Township, and they were added here on this chart in parentheses. Winter storms were most frequent in this area, followed by thunderstorms with wind and then hail. 1 injury and 1 death were reported directly due to these severe storms. An example of a winter storm resulting in widespread injury due to carbon monoxide poisoning happened back on December 22nd, 2013. An ice storm caused power outages in about 400,000 Michigan households, resulting in 81 emergency department visits where carbon monoxide was the chief complaint. A 360% increase in carbon monoxide visits over what we typically would expect. Poisonings were most likely due to exposure to carbon monoxide from gas generator exhaust. Next slide, please. Thank you. So extreme rain events can lead to flooding, which can in turn cause sewer and septic contents to contaminate homes. They can also contaminate surface waters and even wells used for drinking water. Now, one study estimated that 51% of waterborne disease outbreaks followed extreme precipitation events. And we know that extreme rain events are occurring more frequently in Michigan and are projected to be even more common in the future. So what is the risk of water contamination in this area? The most recent data on the number of private wells and septic systems in our state are from the 1990 census of housing. And at that time, about 57% of Michigan housing units had private drinking wells and septic systems. The rest were on public water and sewage. Now, the statistics for Charlevoix County were 56% on well water and almost 63% on private septic systems. If we project these same percentages on the current number of housing units in Charlevoix, we would estimate as many as 9,700 private wells and 10,900 septic systems currently in the county. So flooding can wash sewage from these many septic fields into surface waters and even contaminate drinking water, and that would require well testing and decontamination to reduce the risk of gastrointestinal diseases. And well testing is also the responsibility of the well owner. So you're talking about a significant expense for individuals on the home basis. The risk of runoff also increases with septic systems failing due to age or the lack of maintenance. And in 2013, the Northwest Michigan Health Department identified 139 septic failures in Charlevoix County. The health department estimates as many as a third of the county septic systems being older than their functional lifespans and should be replaced. But there are no statewide standards for septic inspections or maintenance. And a recent MSU study found evidence of human fecal contamination in 100% of major watersheds in the lower peninsula of Michigan. And that's all presumably from septic systems. The Northwest Michigan Health Department has made the issue of septic failures in Charlevoix a priority. So climate change disrupts ecosystems. This is leading to increases in diseases that are carried by animals such as mosquitoes, ticks, and rodents, and Public health professionals call these vector-borne diseases. The spread of the West Nile virus across the United States and into Michigan since 2003 is being a disease spread by mosquitoes is one such example. Thank you. Now, Lyme disease was first seen in Michigan in 1999 and has been increasing in incidence ever since. The tick's development and questing behavior is influenced by a number of environmental factors, some of which, like temperature, precipitation, and abundance of host species, as well as land use and vegetation, those are all impacted by our warming climate. So, for example, milder winters could lead to more deer and rodent hosts, while also lengthening the time period that ticks are active. Human Lyme disease risk is also related to human behaviors such as outdoor activities and choices of landscaping, but longer warm seasons could increase the amount of time outdoors and risk of encountering ticks.
Roger, can you talk about, I understand there's the new tick that's on the manitous now? Is that? You have any
The
information
tick on the manitous is the black-legged tick that we're talking about here for Lyme disease.
It's relatively new, correct?
It's newly recognized carrying Lyme disease on the Manitou Island, specifically North Manitou Island. South Manitou Island, lacking a stable deer population, isn't able to carry the reproductive life cycle for the bacteria. But North Manitou Island is considered a highly endemic location for Lyme disease, and Beaver Island being similar with a stable population of deer and mice and small rodents, we certainly have the factors to continue that life cycle for the bacteria, and there's no reason to believe that Beaver Island wouldn't be similar to North Manitou.
In an island setting, the ticks come from what?
Well, nobody knows for certain, but I would suggest birds as the primary carrier, and also potentially drifting flotsam from the shore. Yep. Thank you. So the black-legged tick vector has been increasing in numbers and is expanding its range. Charlevoix is now among the counties with known risk for Lyme disease, as infected ticks have been found here, and the endemic areas are projected to continue to spread into the future, presumably northern, along the coastline of the lakes first and then inland. So climate change affects air pollution, and this happens in a couple of different ways, but I'd like to talk about fossil fuel combustion meeting electricity demands for increased air conditioner use. We can also see the warmer summers lengthening the allergy season, fostering the growth of allergenic plants such as ragweed, and it may also increase droughts and the risk of smoke from forest fires, not just here in Michigan, but smoke from forest fires can carry all the way from Wisconsin or Minnesota and is measurably significant for respiratory conditions locally. Next slide, please. So here's a distribution of poor air quality in our state, and the estimates shown here are modeling data based on air monitoring from the Department of Environmental Quality and the Environmental Protection Agency. We can see that Charlevoix averaged 5.6 days with more high ozone days than the state as a whole, and that's at 3.6. So while particulates are not much of a concern here, ozone is. So it's interesting to note that the high ozone levels along the west shore of Lake Michigan, which relate both to temperature and to pollution blowing across the lake from Milwaukee and Chicago. With rising summer temperatures, we can expect to increase these pollutants in the future. Thank you. Now, we don't have much information on pollen levels in Michigan. There's only one monitoring station down in St. Clair Shores, but scientists have documented the increasing pollen seasons over the last 18 years, and that's paralleling the accelerating increases in temperature as one goes farther north. We would expect more allergic flare-ups to increase into the future as temperatures continue to increase, and there's also evidence that pollen is becoming more allergenic with increases in temperature and carbon dioxide, further adding to the misery. There's also evidence that tree species are changing with our warming climate. Cold weather evergreens, which are green on the map, are becoming less common, and highly allergenic deciduous trees, which are the yellow and the red, such as birch and alder, are becoming more common. So climate change vulnerability. So who is affected by climate change? Basically, everyone is impacted. However, some are more likely to be harmed than others. And those more vulnerable people include the elderly or very young children, persons with pre-existing health conditions, persons taking certain medications, people that are socially isolated or homeless, people that are lower income, and people who work outdoors. So what do we know about vulnerable people in our community? Slide, please. Here are some census estimates for the number and percent of people in Charlevoix County who are vulnerable because of their age or social characteristics. In particular, we note that the high proportion of seniors at 22% of the population. It's also important to keep in mind that Charlevoix County has been ranked the 9th best county in Michigan for health outcomes by the Robert Wood Johnson Foundation in 2016. It was published under the county health rankings. But nevertheless, there are community health concerns which came out during public meetings by the Northwest Michigan Health Department, including smoking, excessive drinking, and obesity, shown here, as well as substance abuse, mental health, chronic diseases, and all of these characteristics make people more vulnerable to the effects of heat, to air pollution, to waterborne and vector-borne diseases, and to extreme weather events. Thank you. So data from the Behavioral Risk Factor Survey support these community health concerns, showing high rates of disability, asthma, obesity, and arthritis among adults in Charlevoix County. Cardiovascular disease is significantly higher than the state rate, and individuals with these chronic conditions are less able to cope with the stresses of extreme weather such as heat, power outages, or flooding. Thank you. Also at risk are people living in vulnerable places where environmental and structural characteristics may increase hazardous exposures and thus climate health risks. So these can be related to geography, such as living in a city or the country in a floodplain or in areas of the state where extreme rain or other types of storms tend to occur or are projected to occur. It can also relate to man-made infrastructures such as older or failing power and water and sewer systems, or substandard housing, lack of green spaces, or heavily traveled roads with lots of exhaust fumes. So keeping with that in mind, what are some of the vulnerable places in your community? Two types of strategies that are protective of human health: mitigation and adaptation. So for adaptation, those would be actions that are moderating harm, and mitigation would be the reduction and the prevention of carbon emissions. So for mitigation, examples of mitigation activities include regulators reducing allowable emissions. It includes utilities changing from coal and oil combustion to lower emission alternatives. It includes communities making biking, walking, and public transportation safer and more convenient, and employers offering telecommuting or other work schedule alternatives that reduce driving. And for adaptations, examples include, and are really the focus of our program, local health departments working with the media to broadcast extreme heat and air quality alerts, health professionals working with their local planners to incorporate health into the planning process. So for example, to reduce urban heat islands in cities with green spaces, and increasing the capacity of stormwater systems, or to use lower allergy trees and plants in public plantings. And also we've got emergency planners in their communities and local health departments. We've got healthcare facilities and nonprofits developing explicit plans for responding to climate events such as severe storms, or flooding, heat events, algae blooms in the lakes, power losses, etc. We're also going to be connecting with or planning for aiding high-risk, vulnerable populations in the communities. So climate change response also has co-benefits. Co-benefits include actions that benefit the community regardless of future climate changes. For example, increasing energy efficiency, saving money, promoting walking and biking to improve fitness levels in our community, improving green spaces and making more desirable communities, building rain gardens, and lessening pest insects such as mosquitoes. All these characteristics are important for resilient communities. Please. So these are a listing of some of the resources that you can explore to talk more about climate impacts on your health. And that concludes my slides, but I'm open to any questions.
Any questions for Roger?
Right. Right. Mm-hmm. Well, individual years are anecdotal. That would be like saying my grandfather smoked his whole life and he never had lung cancer. But I think we're all pretty well convinced that smoking does significantly increase our risk of lung cancer. So that winter would be a great example of an odd year that didn't follow the typical trends What I think is more striking is that despite that year being included in our data, we're still seeing on average temperatures increasing when you measure by the decade. So over the last 10 years, temperatures are warmer than the prior 10 years, even including that one particular year that we all remember as the worst winter that we can remember in a long, long time. Sure. Okay. Well, I don't think you can simplify something like water levels in the lake to just a couple of factors. Really, there are an awful lot of things that contribute to that. But I would say that we do understand that when the lakes largely freeze over, that there's a lot less evaporation. And what that leads to is less winter precipitation, for instance, snow. But when we have years that are warmer, where the water is warmer, and so we're lasting much longer into the wintertime where the water is still liquid, then you get a lot of evaporation and a lot of lake effect snow. So that's exactly what we're talking about with climate change, is if we're going to see more mild winters and less ice cover on the lakes, we should expect a lot more wintertime precipitation. Ice storms, power outages. Well, ice storms. It's still going to be cold, but we're going to get precipitation that will freeze. Exactly. Excellent questions. Any others? All right. Well, thank you very much. A lot of fun.
All right. All right, I'm going to go through quickly because really tonight we really want to hear back from you. So I'm going to go quickly through something that we hope to kick off in October. So some of you have heard that the island is working on a water trail idea or water trail concept. So I'm just going to provide a couple of slides on what that is. And it's really kind of, I like to say, Michigan's new frontier. It's kind of cheesy, but it is in terms of trails within Michigan, even though it's somewhat of a no-brainer. So what is a water trail versus something I've been paddling for years and decades and has been around since the Native Americans have been here? There's not much. So obviously they're recreational routes on waterways. They're supplied or they're supported by a network of public access points, which I know you have many of, which I know are not marked and not utilized probably the way they could be, something we're going to talk about. They're supported by a broad-based community partnership, and that's really the difference between this kind of a paddling route and something that's a water trail, is there is a group of people or an island or an individual or a group of organizations that say we are defining what this water trail is for our location, and we're going to work to promote it, to publicize those public access sites and provide those amenities. And obviously by doing that, you're helping to both kind of carve the path for conservation and recreation opportunities within the community. And for Michigan, it's a no-brainer considering we have 63 navigable rivers within the state, many more than that, and over 3,000 miles of Great Lakes shoreline. This is what, it's kind of hard to see in terms of clarity, but this was a map not only 7 years old, there were 11 water trails, defined water trails in the state of Michigan. There's 41 now. So communities all across the state are working at defining these. There's now a water trail just about on every mile of Great Lakes coastline. So if some of you have heard about the Iron Bell Trail, they're building the trail from Detroit to Wisconsin. We've already done that with water trails. You can paddle from Luna Pier all the way to Wisconsin and then all the way down to New Buffalo on a defined water trail in the state of Michigan. And they're on all locations from our most urban areas, downtown Detroit and St. Clair, to our most rural areas. And this is what we're going to be talking about, doing something here around Beaver Island. Part of that will involve a process similar to this. So we'll be dovetailing some of these processes where we're working with local officials and local stakeholders to identify where are the access sites that we want to promote around the island, what public sites do we already have, what amenities do we want to have at those access sites, how do we do things like signage, how do we do things like mapping, all the things that go into that we're going to do as part of this process. Some of you, hopefully, will get the actual chance to paddle with us because we have to actually go inventory all those sites. That's kind of the fun part of that. and we'll come up with a water trail plan for the island that will hopefully get you to essentially a water trail. Again, dollars, a lot of dollars coming from the Office of the Great Lakes. One reason why there's a water trail on every mile of Great Coastline is because it's a priority with the Office of the Great Lakes. They are funding that project as well. So a great deal of emphasis now coming on not only on Lake Michigan, but all of the Great Lakes. So there's water trail planning going on the north shore of Lake Superior and Lake Erie and so forth. So a great deal of emphasis and a push towards water trails. If you go and look up the DNR's trails, comprehensive trail plan, there's a priority for state water trail system. The DNR just on Monday released draft criteria for water trail designation. So the DNR has been kind of slow to the game. They're catching up. That will probably be out in terms of official this coming fall. Some of the things that we'll be talking about when we talk about water trails are the economic impacts of those. This thing just doesn't want to work. And it's huge. So if we look at some of our industry guides, paddling sports are one of the biggest increases in terms of usership and money spent. So kayaks went from $4,000, you can get a pretty good kayak now for $300. And so people are doing that, and the economic impact is pretty huge. Michigan Economic Council estimates that in terms of kayaking as an industry in the state of Michigan, up to $140 million of economic impact. Michigan Sea Grant, which does a lot of research on waterways and economics around the Great Lakes, estimated for the Midwest, these numbers, into the millions and billions of economic impact. So there's an opportunity to add to that ecotourism thing that we talked about at the beginning of tonight's presentation. One more thing that the island can consider. What is the economic impact for Beaver Island? I can't tell you that, but we know that it has impact in other places, and the potential is to do that here as well. Some of the things that we'll be looking at are ways that we can have people that are doing renting equipment. And we already have one on the island I know that was selling or renting out kayaks. If you go to just about any state park on the mainland or any other big marina, you'll see this happening all over. People are renting and buying these places as an economic opportunity. There's such thing as a national water trail. So the National Park Service in the last 5 years has branded 18 national water trails. There are 2 in Michigan. One is on the Huron River, which goes through Ann Arbor out to Lake Erie. One is near Port Huron on the St. Clair River. There's no reason why we can't think of a national water trail maybe one day here on Beaver Island. They have a series of criteria that you have to check off to be named a national water trail, and then you actually have the Secretary of Interior stamp it as a national water trail, but that's something in terms of how we want to go about that process that we're going to consider. Other things that we're going to consider are things like access sites. So what amenities do we have for paddlers, from water trail signs to kayak racks? What kind of things are paddlers looking for when they're on the island? Everything from the most rudimentary kayak rack. This is done as an Eagle Scout project in Rochester on the Clinton River. This is what they're playing in Ann Arbor on the Huron River. Is actually these kind of kayak lockers. Not only for people that are coming to the island, but think of it as a municipal arena. You keep your boat at the marina all summer long. You could keep your kayak at the access site, so you don't have to bring it on your car, bring it down every day. So things to consider about that. The other thing that a lot of communities are thinking about is accessibility. Can we put in facilities, not everywhere, but in strategic locations that allow everybody to use the water trail and kayaking? So we talked about the numbers of people buying kayaks. It's because we have a larger number of people kayaking. So can we provide for amenities that supports all that? And what we found when we talk about these types of amenities, they're really used by everybody. So some of the hardest things to do is to get in your kayak on a slippery ramp. These ramps are used by everybody. There's a number of different communities across the state that are working at doing that. Part of this effort will be inventorying what are the access amenities that we have already. This is a database that we helped establish for the state of Michigan that is also working in Indiana, Wisconsin, and Illinois for their water trail system. It'll be part of the inventory that we do. Other slides that you might have seen as you've driven around the state, it's really become a popular thing. We see it on billboards. The state of Michigan's DNR 2 years ago passed a new rule. It used to be if you biked into a campground, even if you didn't have a site, they would give you one. Now they have paddling. So you can paddle into a state park in Michigan and you will always be put up for the night no matter what, because they're trying to encourage that. Other things we're going to be thinking about are signage. These are different examples. if this would work, of signage in other places in Michigan that are related to water trails, both from the water perspective, but then how do you guide people that are on the island to those access sites? Where are those access sites? Things we'll be talking about. There's an example of one on the Huron River. And then we're going to talk about, when we get going on that process, what does that mean for economic development? We call this trail towns. You're, in fact, already a trail town because you have the walking trail, the biking trail. But we're going to talk about what does the water trail mean for the economic development of the island. We helped to create a statewide database and website for water trails. This is a one-stop shop for water trails in Michigan. If you're curious in that, we want to put all the information that we do as part of that process on this website as well. So those are some of the things that we'll be talking about as part of that process.